All right. Welcome, everyone. Thank you for joining us today for Behind the Scenes in Medicaid, How States Are Navigating a Changing Environment. My name is Allison Hamblin. I serve as President and CEO at the Center for Healthcare Strategies, and we are absolutely delighted to have you with us today for a pretty incredible panel discussion. I feel a little bit like a host on the red carpet at the Medicaid Oscars because we have such wonderful panelists with us today. And we'll get to our conversation in short order. But first, I'm going to go through just a few housekeeping items. So if we can go to the next slide. We are recording today's session for future viewing purposes. For those of you who are interested in closed captions, they are available at the bottom of the Zoom screen. And if you'd like to submit a question for potential inclusion in our panel discussion, please click the Q&A icon located at the bottom of the screen at any point during today's discussion. Next slide, please. For those of you who are not familiar with the Center for Healthcare Strategies, or CHCS, we are a Medicaid-focused nonprofit organization based in New Jersey, working nationally. We provide a broad array of technical assistance services to states and their partners. We offer platforms for peer convening. We develop a ton of practical tools and resources to assist in policy design and implementation. And most germane to our event today, we invest in leadership development for those overseeing state Medicaid policy. Next slide, please. And to that end, we are thrilled to have recently launched the National Medicaid Leadership Center. This is a newly created national hub for all of CHCS leadership programming. It houses our broad array of initiatives and service offerings that aim to build capacity among individual leaders, their teams, and their organizations. And as exemplified by today's panel, the center also provides a home for an array of thought leadership activities, which are made possible through contributions from our inaugural sponsors, Kaiser Permanente, Humana, and United Healthcare. These sponsors share our commitment to investing in the public sector leaders who are so critical to an effective, efficient, and impactful Medicaid program. Next slide, please. With that, I am so thrilled to introduce our exceptional panel today. Across this group, we have over 20 years of tenure as Medicaid director and extensive national leadership roles as well. We will be joined by Stuart Portman, who is Medicaid director for the state of Georgia and also serves as the current board president for the National Association of Medicaid Directors. We have Melissa Bird, Medicaid Director for the District of Columbia, who is former board president for the National Association of Medicaid Directors. We have Jamie Snyder, who is currently an independent consultant, but formerly Medicaid Director in both Arizona and Texas, and also formerly an NAMD board president. And last but not least, we have my dear colleague, Mark Larson, former Medicaid Director in Vermont and the leader of our National Medicaid Leadership Center. So I welcome you all to be on screen. Thank you for joining us. And now we're going to get into our discussion. So welcome. Please come off mute. And our goal here for our audience is to really just have a conversation. And so thank you all for being here. Melissa, I'm going to point our first question to you. Welcome. It goes without saying that this is an unprecedented, busy time for Medicaid. And with our audience here today, I would just invite you to impart one thing that you wish folks understood about the realities of running a Medicaid, whether that's in this particular moment or just in general. So thanks for kicking off our conversation.
No problem. Thanks, Allison. It's great to be here today with Stuart, Jamie, and Mark, and yourself. It's really hard to narrow it down to just one thing, so I'm going to do kind of one and a half. I feel like it would be remiss if I just didn't acknowledge that one of the challenges or what us, the folks at Medicaid are experiencing today is just a lot of change all the time. And that's coming off of a lot of change in unprecedented times with the public health emergency. But when I think about Medicaid, and for me, that's nearly a 20-year career in health policy and the Medicaid specifically, I think one of the biggest challenges that's kind of new and different and has been growing over time is the interrelatedness of the Medicaid program, not only to the healthcare system overall, but just in how we may even interact with other district or state agencies. But I know for us in the district, over the past couple of years, we've been working through some significant changes to our revenues and tighter budgets, which I know a lot of other directors across the nation are starting to, or have already been talking about it or working through. And, it's always that thinking, well, if we make a change here to Medicaid, what does that do to our overall system within the district? So, a small change in Medicaid can take out hundreds of millions of dollars out of your healthcare system. And you have to be really thoughtful about that and the overall impacts that you're having. I also think, and this I think is really relevant for a lot of us now, is, many states like the district have an integrated eligibility system. So we're making changes, but we have to really be considerate of and work more closely with some of our counterparts, like with those folks who operate or implement the SNAP program. It's not now just like, oh, I need to make this change for Medicaid eligibility determinations or processes, but it's also, well, if we do that, how's it going to impact the SNAP program? And so the complexity is just increased, I think, over time. And then as we're making changes for work requirements, community engagement, I think another area of that interrelatedness too is how we communicate. There's so many changes, and how are we communicating about the changes in Medicaid versus the changes to SNAP and so on. For the folks who might be in Medicaid, there's a good chance they might be utilizing SNAP benefits as well. And so how do you have that kind of clear and consistent messaging when you're talking? So it's just, I know I think about SNAP more often than I ever did. And so those are some of the changes, really. It's just as Medicaid has grown over the past decade, I think it's hard to talk healthcare without obviously considering Medicaid. So it's a big difference, I think.
And I was just to tag on to that, Melissa, I really appreciate your point about the interrelatedness of the program now and the need to work with outside partners, other state agencies, health plans, providers, community organizations in accomplishing the program's goals. I know that was something while I was in Arizona, we focused a lot of energy on, especially as we started to look at branching out into social determinants of health and really using that collective impact model where we brought in system partners that could bring not only expertise but resources to the table. So Medicaid wasn't really carrying the entire ball when it came to being able to extend those types of supports to individuals. It became very clear to us that we weren't going to be able to do it alone. It didn't make sense to do it alone. And we had system partners that could bring that expertise and, more importantly, probably the resources to the table.
I'll
Jamie, I
also,
think that's such a key point. Oh, sorry, Stuart. It's
no,
also that while there's a lot of interrelatedness, I think too, when you talk about the healthcare system at large, I feel very strongly that Medicaid can't solve all those issues. And so whether it's collective impact or how do we talk about the other key players within the healthcare system if we want to slow spending or change how we get to outcomes or try to improve on outcomes overall. So I think I just 100% agree, Jamie. Sorry, Stuart.
no, I was just gonna to further appreciate your comments on integrated eligibility systems, and I think that they are the perfect example by which, when we talk about the current realities of what it means to be in Medicaid, is also people think that it's a lot of like policy and getting everyone together and having the discussions, and that's important. It's a huge part of what we do, but the operational side increasingly is filled with a number of contract and procurement related discussions, and I think that that is less well understood, but very important because of the fact that there's a reason why it's important to have a strong procurement law. But I think as infrequently those decisions are made outside of Medicaid agencies at a state level. But some of the important elements of how we can guide a program, our teams can guide programs, the governor's vision can be implemented, are frequently hitting. What I'm going to say is that something that should be a stop sign is a roadblock, and we have to find a way to readjust that so that we can make sure that implementation of important ideas doesn't take multiple years in order to implement change, because that will have a stymieing effect more broadly.
Yeah. Stuart, I'd love to build on that point, because sort of in lifting up the operational aspects and the procurement challenges that are likely grounded in current implementation, are also connected to, as you lifted up, sort of a longer view, a bigger picture of changes that need to happen in order to effectively steer an agency and a program in a very dynamic environment. And so, to turn that into a question for you, how do you think about, as a Medicaid director, addressing and managing through the current challenges, which, any given day is this fire or that fire, or, this deadline approaching? How do you balance that with the longer view towards, your longer goals and objectives for the program, whether related to cost, quality, access, what have you?
Yeah, I think a lot of it starts with leadership having the right mentality, right? I think that there's a recognition of the realities of these roles and the responsibility that rests with us in managing these programs. And by that, I mean, if the goal is to say there should be no fire drills, there's going to be a lot of very unhappy people operating because there's a fire drill every day, right? And part of what it means to lead with a long-term view, especially when you're trying to ensure that there is good stewardship of funds, that you're actually trying to improve your program. And there's different visions on what that improvement can be, right? We talk about that all the time amongst the Medicaid directors. Some people want to do the basics really well, and some want to be known about innovative ideas to transform care. And depending on your state and the direction of your state leadership, both of those are equally valid. However, it is, I think, one truism that I've experienced is that one of the hardest elements of leadership in Medicaid is that everything is important. But if everything is so important that it is a top priority, you find yourself lost and you've deprioritized everything. And it is those choices where you have to recognize that there are trade-offs, and they can be worthwhile, right? You can find yourself paralyzed in thinking about what the future holds and saying, I want to move to a world that is more quality-based. We've transformed the delivery system. We're moving away from volume. But I also need to deal with these 6 things that my state legislators need done immediately. And I also need to have a discussion about how we are adding more compliance measures for high-risk areas, and we have to have a whole new plan enter our market, right? Like, that's a lot of things, and that's like a tiny subset as an example I was making up on the fly that is still like, a sixth of what we would deal with on a given day. Although hopefully not a new plan every day. But that is a big picture, like a very real discussion of how we navigate the current challenges, right? Everyone is implementing community engagement right now. It takes a full of everyone that is eligible to those states. There's a few that are not dealing with community engagement, but those of us that are all dealing with it in a unique way. Everyone is working towards the program integrity efforts from the administration. And there are both the things that we have a lot of awareness of, and there are also things that pop up every day without much runway, right? And being able to respond and understand what that means is very much so top of mind for folks. We have a number of financing changes underway, right? Whether or not you're talking about state-directed payments or the current changes proposed as it relates to budget neutrality for demonstration waivers in the Medicaid program, there's a lot of, depending on your perspective, there's a lot of dramatic change or there's a lot of opportunity for rethinking program design. And both can be equally true. But at the end of the day, in a leadership role, you have to have a vision of where you're going, right? You have to know that you are, in my mind, right, we're working towards being more member focused, always. You're always trying to simplify and reduce unnecessary burden for both the member and the provider. You're also trying to ensure a high quality program. And that means both compliance for anyone that you are, we are regulatory agencies, and we have to have a level of compliance to maintain that stewardship of the funding. We also need to make sure that the outcomes of care are maintained, and there's a compliance element of that. There's also an element of trying to say, how are we doing things and what are historical issues, right? When we look at maternal health, when we look at chronic disease burden, when we look at behavioral health, there's a lot of work to be done. And proposing new ideas that can actually reinforce some of the good things that have happened, because every state has them. A lot of focus ends up on the bad, but there's a lot of good effort and good people making strong efforts. And if we can take what we've learned and expand upon that, that serves as a better vision when we're dealing with the issue of the day. Even if the issue of the day can span a couple of years, at the end of the day, if you're trying to transform your system, that's a multi-year effort, and that has to have a through line in what we do as leaders.
Gosh, Stuart, I just really appreciate your first point around letting folks know and being transparent about the fire drills that are going to occur naturally. There's really, at least in my experience, there's no way to insulate any one person from the being involved at some point in the fire drill of the day. And just I think that level of transparency out of the gate is just really so important because it allows people to understand what's, going to happen on the ground, but also remain focused on the priorities of the program and the state.
And I agree. I mean, everything that Stuart said, just in terms of the different issues any director or Medicaid staff person might be handling in a day, I found with my team here, I think it's really helpful, particularly for those bigger initiatives, but really for anything, that you set out like a real simple statement at the get-go, right? What is your success? Success for unwinding for us, it was success was that, no one or anyone who is eligible and enrolled remains enrolled, right? And when those super crazy days and a lot of things popped up or popping up and you're trying to deal with those fire drills, but you're also trying to move those larger initiatives forward, you can really go back to that statement to like answer that question that's at hand. Does it get us to the success statement or not? And it really kind of, I think it can help empower your team to make those decisions when you're, as a director, maybe pulled in a different direction. And it also just keeps you grounded. So for like whether it's Stuart or myself, and we've spent 8 hours in our day on something completely unrelated to the number one issue that's now pulling us back, we can also look and be like, oh yeah, this is what we're focused on, and let's keep moving forward.
And so much of that too is just about communication, right? As the leader of the program, being able to use team meetings, all staff meetings, your written communications to reorient to the kind of priorities and strategic agenda of the program. It's just super important in particular, in the midst of times like this, where we're seeing a lot of shifts and changes in the program.
And maybe,
I'll also say too, I mean, oh, sorry, go ahead, Mark.
Melissa, no, I'm happy to defer to you.
I was going to say, I think one thing folks might be surprised is I think a lot of leaders in Medicaid really are creative. And we have lots of opportunity for creativity in our day-to-day lives, if you will. And while there's every director today feels like there's a lot on their plate, I think Mark and Jamie would also say they had a lot on their plate when they were in this role. And so it's not exactly new to directors to have to, have your priorities determined from folks that are outside your, that aren't you and things like that. And you handle it, and then you get creative about how you still move forward on those things that are important to the agency and to the program that might not have that spotlight. So I would say I really do think you see a lot of that creativity at play every day in the life of a Medicaid director. Go ahead, Mark. Sorry about that.
No, just building on that too, Melissa, I appreciated your original point about the interconnectedness of Medicaid. Medicaid means a lot of different things to a lot of different people across the country. And Stuart, to your point about the importance of having a real clear sense of vision, it sparked for me, and some of you have heard me make this point, that over this 60-year history of Medicaid, right? I mean, it's been evolving for a long time now, and always in the context of tension. That sense of what is the vision, what's the value of Medicaid means different things to different people. For some, it's how do we create continuity of care to create greater population health? For others, it's, hey, this is a social welfare program that should be limited and um, for certain people. Uh, if you talk to my father, he probably would have thought both of those things at the same time. And so it's not an either or. It's, this unfolding and all those fire drills that, dedicated public servants and Medicaid programs are dealing with all the time. I appreciate that they're doing it in the context of an evolving historic tension about a bunch of different visions for what Medicaid's value really is.
Yeah. Thank you for all of that. I appreciate everybody's contributions there. Melissa, I'm going to build off a comment you made just a moment ago about Medicaid directors are creative. And Jamie, I'm going to turn to you. In your experience, whether in Arizona or Texas, Stuart lifted up earlier, for some, there's always an innovation agenda, lurking somewhere, right? Like, what is the innovative thing that we can or we should be doing to drive better outcomes in this program? What are the realistic constraints on that creativity as Medicaid director? And also, in the face of those constraints, how do you promote innovation and creativity among your teams when you're working in that environment?
Yeah, I mean, Melissa set this up perfectly, right? And just to start out, I would say there are a lot of creative folks in Medicaid agencies. I mean, it's sort of the nature of the beast, right? With the evolving nature of the program, folks have to be able to sort of put on that creativity hat when things get tough. But we all know that time, capacity, and leadership support can really stand in the way of creativity and innovation, particularly during challenging periods. So I think there are a few things that leaders can do to continue to foster creativity and innovative thought during times of change. One, and I think this is kind of the primary one in my mind, is make sure that your team knows it's okay to challenge long-standing assumptions. And that, certainly involves leaders within the organization, but probably more importantly, you want to bring in those folks that are on the ground, whether they're doing eligibility work, contract monitoring work, work across the program where they're interacting with members that the program serves and providers and health plans, and really tap into their sense of creativity and some of the solutions that can be made on a more incremental level that could ultimately make a big difference in the program. Going back to one of Stuart's earlier points about, for instance, reducing administrative burden on whether it's providers or plans. I think you'll find that folks throughout your program and your agency will be able to offer some really useful solutions around some of the challenges that exist. I think the other piece of the equation in terms of fostering creativity and innovation is bringing in your system partners early. And so in a managed care state, that certainly includes the health plans, but also providers, community stakeholders. I know during the pandemic, as an agency, because we had to act really quickly, we couldn't always rely on data like we had historically to make decisions. And so we really turned to those system partners to help guide our thought process and some of that decision making. And most importantly, tapping into the sentiments of members and their families. They can be such an incredible resource when you're trying to come up with creative solutions during times of change. And then kind of going back to my earlier point, oftentimes the most impactful changes are incremental in nature. You don't have to be standing up a new program in order to have a real impact. You don't have to pursue a new demonstration waiver. And in this day and age, maybe that's not the best solution anyway. But really looking at some of those incremental changes that can be made that can, in particular, make the experience for beneficiaries or members more seamless, but also looking at changes that can truly impact in a meaningful way providers' experience and plans' experience.
I'll jump in just to share that, I agree entirely, Jamie, that the creative angle here, right, is that there are people that want to think more creatively and feel constrained, or that they can't think big frequently because of past decisions. But because of the constant tension you have to, once you shift your worldview and look at that tension in the positive light, right? There is no Medicaid without politics. And I think a lot of people think that things would be easier without the politics, but Medicaid doesn't exist in a world devoid of politics. That creates some of the tension that Mark was speaking about. In that political back and forth, you can get some real creativity depending on whether or not you're talking about growth or constraint or new or old. There's opportunities to build on what has been done, and there's a partnership angle both within the state and also with the federal government. And I apologize if anyone from CMS is on here, but there's a lot of states that sometimes fear a CMS conversation where they say we don't think you can do that, and everyone says, "Oh, that's now in the graveyard." And I just don't take that same perspective. I think that if CMS, there's an opportunity to engage in a conversation because something is meaningful. If it matters to the vision of a state, engaging in that conversation and repeatedly engaging in a conversation helps you find a path forward. It may not be the path you originally envisioned, but if there's a reason to be doing it, partnering both at the state level and at the federal level to help accomplish that goal, depending on the levers you have available at any point in time, because they're constantly changing, that is really an amazing opportunity. So really, Medicaid leadership is great for people that like to play five-dimensional chess at any point in time.
I love all of that. And the point about, the like shifting your frame to welcome the tension and view it as sort of just like central and foundational to the Medicaid program as it always has been, and as a source of generative creativity is just a really healthy outlook that I really appreciate. And Mark, I want to turn to you. So, you spend a lot of time thinking about how to build capacity among Medicaid leaders, whether it's at the Medicaid director level, the deputy level, across agency staff. Hearing this conversation and thinking about the new opportunities you're leading, with the expansion of the Leadership Center, what to you stands out as the most critical array of supports that states need in order to, build the organizational capacity to, harness these creative tensions?
Yeah, Allison, I mean, we have a special opportunity that we get to hang out in Medicaid programs around the country quite frequently. And I appreciate, we've already talked about their role as fighting fires, right? The fire drills. We historically have talked about Medicaid as administrators, right? Those technical folks who know all the policies and can implement them successfully over and over again. When we think about the complexity that we live in today, I would maybe argue that the muscles that really are the new ones that are really important is the internal capacity to develop critical thinking, to foster matrix governance structures, which sounds really boring, but the ability to, grow leaders who are influence builders, who can help navigate, Stuart, to your point, the inherent politics that it takes to translate a vision into an operation and to build the relationships that are needed to get things done in that kind of environment. And I think so many new Medicaid directors that I get to talk to come in thinking, am I smart enough for this role? And I think we have to give people permission to not worry about, do I know every federal regulation? And really think about themselves as coaches and mentors of leaders up and down their organization that builds the capacity to be agile enough to be successful in the world we live in today. Oh, Allison, you may be on mute.
Thanks, Mark. Appreciate that. Talk about, skill building, unmuting on Zoom. I'm going to turn us back in the context of vision and the long view here, again, with so much focus on all of the urgent priorities and implementation timelines, it's really important, and I've heard you all articulate this in your various ways, to keep the long view in mind. And so, Melissa, I'm planning to turn to you first if you are available, and if not, I will turn to one of your very agile colleagues here. But looking ahead, let's call it 1 to 5 years. What emerging issues or opportunities do you expect will most shape Medicaid priorities, strategy, care delivery? I mean, there's a lot out there. So pick your favorite. But if as you are looking ahead, what are the key things that you're focused on to sort of keep driving towards those long-term goals?
Sure, and I apologize. I'm here definitely by audio. Video seems questionable. I do want to just take a moment to reflect on Mark's comments and just say I fully agree, and it's so interesting. I've been in this role for a few years now, and I feel like the longer in it, the less I know about Medicaid because I'm not in those weeds day to day with the new implementation, and so I have a different perspective and I have different knowledge base. But it is really hard. Well, I should say it's hard. What I do agree, it is being able to manage and lead the team that I definitely see as the greater value. And you can always sit down and read the reg and talk to staff and learn about the details of a program. Presuming, I think the biggest one of the more important things is knowing what questions to ask, right? And when you get into this role, you've probably figured that out in good bits. So I definitely appreciate those comments. On the, kind of looking ahead for the next 1 to 5 years, I really think that what's probably going to be really impactful to the Medicaid program, and maybe it's because it's been front and center for the past year, but I think it's what's going to be the national debate and any action from Congress going forward. I think that, I almost chuckled when Stuart talked about not having politics in Medicaid. I don't know that I've ever been mad about the politics or been oh, we shouldn't have politics in here, but I'm right there with you. It's just part of what we have here. And I think that federal policy making, whether if we start with HR 1 or the One Big Beautiful Bill Act from last year, I mean, we're going to be implementing that for several years, for the next 10 years, right? We have a lot going on right now, but there are new changes coming in seemingly every year. So if that stays as it is, that's going to be influencing states. I think Stuart alluded to it earlier. There are profound changes to Medicaid financing through the legislation, as well as whether it's changes to provider taxes or changes to 1115 waiver demonstrations that really states will have to really think through those impacts. And then one thing that I've found different this go around, if you will, is also just hearing the discussion nationally about what people do or don't like about recent legislation and what they might do about it going forward. So I think in the past, I felt like, when federal legislation was passed, it was okay, this is how we're moving forward. We're implementing, we're making those changes, and that's just the path we're on. And for the first time, it feels like maybe, we'll see how that path goes over the next several years. And I do think we've seen some of that past changes, whether it's the Affordable Care Act and then the changes that came in through Supreme Court decisions and so forth. But I feel like we're going to have potential more movement coming from the federal level that might change how programs are thinking on their day-to-day and reacting to those and trying to stay on top with compliance and then everything else that we've talked about in terms of just, it's a state-federal partnership, so there are federal priorities, and then there are obviously state and district priorities as well, and the territories have their priorities. So it's going to be more managing all that, but just trying to keep up, I think.
I love your list, Melissa. I think it reflects definitely what is emerging. I think when you get more into that 5-year window, I will just note there's a lot of discussion in healthcare broadly about trying to shift from paying for volume, right? And having a more value-based system. And whether or not you're talking about that in the care delivery side or in the pharmaceutical side, those are very real conversations. And it happens in Medicare, it happens in the commercial space. But there are some real questions around what is possible based on some of the new rulemaking, based on some of the decision points out of multiple iterations of CMS, as to what we can do in the managed care space. In the world of what creative tensions we've had, there was a time when capitated payments were considered a value-based care model. And I think very few people look at capitation today and say that is value-based care, right? If we're trying to pay for value and outcomes in health, that requires a real shift in our thinking. And by that, I mean, you can't wedge that approach into a system that is focused on volume, right?
Mm-hmm.
That requires a rethink. And that requires a group of creative individuals that cross a whole wealth of different backgrounds and experiences to speak to what that system can be. And it would be a shame in my mind if that conversation excluded Medicaid solely because of regulatory decision making. And so we need to be vigilant as Medicaid leaders to make sure that outcomes-based, value-based care is inclusive of the largest population that we have currently, Vidi payer.
And
Stuart,
Stuart,
love
I
you
think
raised
that
up.
is so. Go ahead, Mark. You go this time.
I love that you mentioned that, Stuart. And maybe if I could just, in that context, raise, I think one of the challenges that we'll face in the next 5 years, more than that, is, speaking as a former state legislator, the volatility in state revenues, which will put an ongoing pressure on what are the resources that we have, not just to keep operations going, but to drive some of those innovations, and to think about where the investments in system transformation, system reform that helps us get to that more value-based system that we all talk about and want to see.
And I also think it's important. I do think we want to see the outcomes for our investment, but I don't think saying more value-based care means less spending in the long run. But I think there are ways you can, we talk about it here, and I'm sure, all you guys know, particularly when you're going in front of your legislature, savings and slowing the cost growth or curve are two very different things. And I do think it's, and Stuart, to your point, and this kind of ties into what I was saying earlier as well, is that like Medicaid alone can't solve these problems. We certainly shouldn't be left out of the discussion of how we move forward, because we are such a key player. I think in every state, but certainly like in the district, nearly 40% of our population has Medicaid coverage. So it's certainly very much front and center here in the district. But I think you really need, the system moving together and some capacity to make those changes. But I also think there's potential for upfront investment before we see lowered cost growth, maybe savings, and certainly those better outcomes.
Yeah, and just to tag on to a few of the points that have been made, I think we're in an era, especially from a budgetary perspective, where Medicaid leaders can no longer rely upon the traditional levers entirely around benefit changes, eligibility changes, and provider reimbursement reductions. This time really requires leaders to think about transformational change that will ultimately ensure the sustainability of programs, which is sometimes difficult when there's a lot going on, but really, really important. And I think you're seeing Medicaid programs across the country really lean in to that need for transformational change, whether it's around integrated care, whether it's around value-based purchasing. There's still, a number of, I think, considerations when it comes to value-based care that Medicaid directors are really tapped into, including ensuring that providers We support providers so they can be comfortable taking on downside risk, and that's where we really see the behavior change. It's an exciting time in a lot of ways when you're looking at, sort of that system level change and the opportunities that exist within that.
Jamie, let me jump on that for a second and you know, opportunities for and need for transformational change at a time where there's a lot going on and at a time where we have a tremendous number of new Medicaid directors at the state level. Um, Folks are coming into these jobs during an unusually challenging time. It's always, as we've talked about in this conversation, this is always a challenging role, but it's particularly challenging at the moment, given all of the operational and implementation hurdles that Medicaid programs are facing. I'm curious what advice you would offer the cohort of newer directors, given all of the things we've been talking about, and this opportunity for transformational change. How do you keep your eye on transformation while at the same time you're juggling all these balls and trying to learn a new job in a really busy moment?
Yeah, and I think Mark really hit the nail on the head earlier on in our conversation when he mentioned that, with new leaders, I think the important part is about building a team that you can trust and not feeling like you have to, out of the gate, solve every problem on your own and immediately, but taking the time to step back, assess the situation, and really rely upon those long tenured leaders within your organization to serve as a foundation for decision making. The other piece of the equation, and we talked a little bit about this as well earlier, is making sure that you're building relationships before you need folks to be on your side. So building relationships with key partners at CMS, with your executive, with the legislature, going out and having conversations about the important role that the program plays with state legislators early and often, as well as your typical partners, health plans, providers, community stakeholders, and certainly members and families, but making sure that you're laying the groundwork for that early. The other piece of the equation, which is something that I think CHCS and the National Association of Medicaid Directors, that you all put a lot of time and energy to, is making sure that you're leaning on your peers. You really create forums where Medicaid directors and leaders can talk with one another. And just want to encourage those out there that are on the line today to really rely upon and lean upon your peers in other states. I found other my peers from other states to be some of the really most important sources of not only information, but comfort and guidance as a leader within the Medicaid program. If not for Judy Moore Peterson in Hawaii, I probably would have left my role in Arizona 2 years earlier than I did. She was a mentor that I turned to often. And then, Stuart, you said this at the onset of our conversation, just really keeping those that we serve, members, beneficiaries, at the core of the conversation always. If you're struggling with a decision, struggling with which path to follow, think about the individual that ultimately is going to benefit from the services that the program offers, and use that as a guidepost for decision making.
I love that, Jamie. Great advice throughout there. Stuart, I'm going to turn to you now. We're still in this, portion of the conversation around kind of the long view here, and thinking ahead for, I don't know, 1 or 2 years. You could go 5 years if you want. How do you define success? And how do you think about whether it's for Medicaid programs nationally, for the state of Georgia, recognizing success could look different state to state. But what do you hope to see happening within Medicaid programs, and which like all of us in the broader Medicaid ecosystem be looking for over that time frame?
A small question.
Yeah.
But I do think that, especially because we are in an election year, right? There's a lot of change in that regard. And to the point that, the answer that Jamie just shared, and to your question, Allison, number of new directors and new deputies and new senior folks is significant. And it's significant before we even get to an election. And so having, one from a national perspective, we also, more than a few Medicaid directors with some seniority have since decided to either retire or jump into new careers. And one of the net effects of that is that the average lifespan of a Medicaid director is now very short. We are under 2 years for sure. And it would be wonderful for that to rise, right? To make sure that the Medicaid directors and their senior leadership teams in particular have the support that they need to stick around, knowing that it's not exactly going to feel like the easiest of times, but that there is work worth doing and that the team's support is there to continue to do it. Because I think that there are always going to be dedicated public servants to try to do the work. But I think what is at least evident to me is that you need leadership that is willing to learn from those that have been in the trenches working on this and then develop a vision from that experience to guide the vision. Because there are lots of people that can implement it, but it does take a little bit of heft or leadership muscle in order to make sure that a vision can be the through line that we've discussed that it should be, to have a long-term goal. And that requires consistency in leadership. If you're constantly changing leaders, Medicaid becomes a regulatory payer. That is what the agency becomes. You don't have innovation, you don't have improvements, you don't have transformation. You focus on being a payer and a regulatory entity. And that is a function, that is a base function of a Medicaid agency. But there's a lot more that we can do. Not saying everything, Melissa, don't worry. We should not be everything. But there's a lot that we can do in the Medicaid space. And that to do that requires a level of consistency and leadership. I do think that I would love to see more and more decision making focused on what is the impact to the beneficiary, because I think it's very easy for us to get lost in all of the other noise that's out there. I have instituted a challenge to my own team that I will say is not going to claim we meet it every day, but it's something that it's critical thinking in the back of our mind that we say it's important to have is there a way for what we're doing, regardless of what the activity is, to take whatever the policy outcome is and limit any steps we take to ensuring there's only one step between a decision of the department and the impact to the member. One intermediary step, right? We got to give a little understanding that there's a lot of people at play. But can we simplify systems so we're not building complex processes that make people think that there's not a lot that we're doing that is member oriented, even though at our core that is 100% what we are doing. But it's hard to see that through the minutia and the haze that is processes and what people might view as unnecessary bureaucracy, regardless of the functionality that it serves. And so if we can stay member focused, I think states will be very successful in trying to share those visions more broadly, because people will realize that, regardless of your state, the team that's working on this program that is frequently one of the top 4 line items in the budget is actually trying to serve people and prevent unnecessary cost growth, and not just there to turn wheels and just sit there pushing paper. So that's what I would say for my thoughts on what we can do in the future.
Allison,
yeah, and Stuart, I would say too that we're linked, Mark.
yeah.
I would also say too, I do think there's a lot. I think to really maybe shorten what I just heard from you is that programs will be successful or can be successful. They center the member, and their decision making comes from that being front and center, right? And I think that's absolutely right. Operationally, I think some of the discussion we've had about how do we improve outcomes and make changes to our system, in my experience here, I think a lot of what we think is the problem isn't really the problem. And the more I talk to folks that are on the program, I'm like, oh, okay, this makes more sense. In DC, we've had a lot of, at least back when I started in this 20 plus years ago, it was you just need to have coverage and then people will access care. And I've been fortunate to be in the district where we have a lot of healthcare coverage, And still access is a problem. And the more we have the lived experience and the individual's voice in our conversations, the more, at least my takeaway is, if it gets into really discrete issues that I think are really much more difficult to solve. Again, they're beyond Medicaid, they're systemic. And then, there are reasons why people, I know we hear a lot like, oh, folks on Medicaid don't access care. And I've seen instances, there's a lot of attempts to access care, but it's a really undesirable experience or just a bad experience. And I don't think that's unique to folks on Medicaid. I think a lot of us have a subpar experience in the healthcare system. And it's getting to that piece right there. Why was that a bad experience? So bad that I'm not going to go back and re-engage in the healthcare system. But I will say, and I think others probably feel similarly, but I mean, that's just I don't know how to solve that question. So maybe, Mark, you have the answer, and you can chime in, or someone else on this panel. But those are some of the, I think, the really tough questions. Or if we're sitting here as the director and asking why isn't this happening, I find a lot of the answers you definitely get from the people that you're serving.
Yeah, and I mean, you all spark for me, and forgive me if I'm a broken record. I mean, you make the case for why we at CHCS think investing in leaders is so important, because if you can increase tenure, if you can increase the capacity of leaders, not just to survive individually, but to scale their leadership up and down the organization. Probably important for us to say, when we use the term leader, we don't mean it to mean just the top of the org chart, right? We talk about leader as individuals up and down organizations. And when you pair that capacity with the ability to stay connected to member experience, that there really is a direct ramification in terms of what Medicaid programs can achieve and what success looks like. And I think we're pretty proud to be able to say that, some of what we've done has really had a profound impact on how long Medicaid directors stick around, right? And what the pipeline for folks rising up into those positions looks like. But I appreciate your ability to articulate that in really concrete terms, because I think we often get hung up on the technical components of Medicaid that make it so hard to move fast, or make it so inaccessible for people to understand.
Yeah.
Yep.
Mark, I want to build off that, and I'm trying to work in a couple of questions from our audience, some of which were submitted in advance before we wrap up here. And related to the point about tenure of a Medicaid director is retention of your staff and your teams. There's lots of institutional knowledge. There are lots of really talented people who are critical to all of the operational issues and decision making and implementation that you've been referring to. And I'd love to hear from some of you on, in your experience, what are key strategies to retain talent in a Medicaid agency and to keep people in the game in what can be a really, difficult environment, meaningful, mission driven, but also frenetic and difficult at times. So would love to hear any sort of best practices as you've implemented them in your organizations.
I was just going to mention, just tying the threads together from the last conversation works really nicely with this particular question. So much of retention is around individuals' understanding of how they contribute to the mission of the organization. And the mission of Medicaid organizations is really around ensuring members are able to access quality care. So I think just spending time with staff at various levels of the organization and understanding, even if they're doing behind the scenes work, how that work is instrumental in driving the member experience can be really, really powerful. And I think, the other kind of piece of the equation, at least when I was in the role, was ensuring that individuals throughout the organization felt empowered to make decisions. And again, going back to an earlier point around making sure that they're able to and feel safe challenging longstanding beliefs or processes. And then the other piece of the equation was, for me, was always making sure that folks felt like they that we were investing in them from a professional development standpoint, and allowing for those opportunities to collaborate with folks from other states, take classes that were going to build credentials or skills, and would ultimately foster opportunities to progress within the organization.
Jamie, building on that,
100%.
yeah.
Go ahead, Mark.
Well, I just wanted to compliment the three of you because I think when I think about Jamie, your point, we reward middle sort of deputy level leaders for their ability to fight fires. And I think translating that or transforming that into building the capacity for people to mentor and coach others and create those environments for people to succeed. Each of you, I know, have invested in that. And, it's indicative of the ability to see the people that you have spurred sort of in your wake, which I think is just an example of, Jamie, what you're lifting up there.
I'm just going to say, I completely agree with everything that Jamie said. Part of me was going to say, I don't think it's hard to keep people sometimes because it is mission oriented or mission driven work, and that's why people come and they want to stay. But certainly everything Jamie said, plus I feel like one of the areas where I spend a lot of time with my team or talking to staff is more about how the work as a public servant, and I'm sure in many other areas, like the work just doesn't end. It's never going to end. You're never going to walk out with a clean desktop and come back the next morning and it's still clear. And so I think there's a lot of learning how to really, prepare yourself and be prepared to really manage from the long haul, if you will. That there are the fires, but how do you navigate through those? How do you, turn off at night because there's always work to do. The other piece I find really important is celebrating those real small wins. To the earlier comments about the short tenure of Medicaid directors, it can, Medicaid's a big ship. It can be really hard to see change. I feel really fortunate being almost 8 years in that I can see some change that if I was in for a shorter period of time, I wouldn't have been able to. So I'm starting to get to see some of that longitudinal. But for folks who are shorter their tenure, whether it's another director or staff here, particularly when folks come in, we're going to change this, we're going to implement that new innovative system. And I really think you have to look at it in some bite-sized pieces. I've told folks 100 times when we finally got several applications to be on our member advisory committee, when we used to have to solicit, beg people to join us, that was one of those little wins that was really feeding to, it's a small change, but it's been slow and steady. And so I think really talking through your staff about how you stay strong for the long haul, if you will, and manage those day to day so that you don't burn out and that you can see that the good that you're doing and the impact that you're having.
I love all these tips. I'm sure our team is writing them down and we'll package them in a brief of of some kind to share more broadly with the field. Stuart, I'm going to turn to you for maybe a 30-second response to close us out. We've gotten some questions about any advice you have for the array of Medicaid partners out there, whether it's community-based organizations, providers, plans, like the broader ecosystem. What advice would you give to them about how to effectively partner with you all and state agencies across the country in this time of major Medicaid change, whether it's financing and so forth? What's your wish from your broader set of partners out there?
I think my short answer is that keep reaching out for that conversation, right? If a conversation doesn't happen, it doesn't mean you're being ignored and there's some intentional element that says we don't want to work with you, right? It means that everyone is just a little underwater at the moment, but don't take it personally. Keep reaching out because I think every state spends a lot of time having those conversations to build the personal connection that you can't just get over email or a LinkedIn message or a friend of a friend, right? You need to have that sit down discussion to be able to, or virtual discussion if need be, to actually understand what you are bringing in and then take it as a positive if you're redirected, right? Like if the state tells you you're better off working with our plan, or maybe there's a coalition of providers doing some great work, view it as a positive that there's a desire to actually connect you to the right entity that can work with you. And don't view it as getting brushed off, because in reality, not everything actually is managed, like overseen or managed from the state perspective. There are some on the ground elements that a lot of our community partners are better suited to solve with folks that are more on the ground. And so view that connection as a positive at the end of the day.
Great advice. Thank you all so much. This hour has flown by. We're deeply grateful for your time today, for sharing your insights with our broad audience here. We wish you all the best of luck as you navigate the waters ahead, and look forward to another opportunity to get together and pick your brains. Thank you all. Have a wonderful rest of your day, and we'll be in touch soon.